It's a public health epidemic, and it is at crisis levels.
We still have people who are dying every day.
Somebody who overdosed in their car on I-5.
Heroin, or an opiate overdose, kills someone in King County every 1.5 days. And the number is rising, not just for those on the street, but across all socioeconomic backgrounds.
I can speak personally that my brother died of a drug overdose 12 years ago, and he was a college graduate. He had a good paying, excellent job at a bank. He was doing well for himself, and nobody knew there was an issue until one day we got a phone call from the hospital that he had died.
In 2016, the Heroin Opiate Addiction Task Force was formed to find solutions. Its first recommendation: prevention.
80% of people who newly start heroin started with prescription drugs.
Prescription opioids either prescribed to them or prescribed to someone else, and they were diverted, misused, look through a medicine cabinet, someone in your family, friends, or buy on the street.
Our prevention recommendations really focus on moving upstream, right? How can we change prescribing practices? How can we change the way conversations are happening at doctor's office? How can we change the way we're looking at opiate use disorder?
Besides educating prescribers, the focus is on safe storage of prescription meds and safe returns or take-back sites for unused pills. Also, more screening for opiate misuse in schools and healthcare settings. There's also a strong focus on treatment.
Treatment is really the foundation of our response, both locally and nationally, to this epidemic. We have treatments that will reduce the risk of death by 50%.
We have to be able to provide treatment to people where they're at, when they need it, in a way in which they'll accept it. Because if my treatment resources say, yes, you can come in and receive treatment. We know you have a heroin issue. You can come in treatment as long as you jump through this hoop, this hoop, this hoop, this hoop, and this hoop. For people who are already having really a hard time living their life on a daily basis, we're not going to be successful. A great example of something that the task force brought together was providing treatment resources in a low barrier way at the needle exchange.
Hi, come on in. You can just drop your used syringes right there in the chute, and we'll give you whatever you brought in. It's a one-for-one exchange.
So we know that people already come to a needle exchange for health services, right? For HIV, STD prevention. Many people who are already intravenous drug users. So if we can say to them right then and there, hey, do you want treatment?
We have social workers here if you want to talk about treatment options. One option we have on site is a Suboxone program called Buprenorphine Pathways, and you can get medication today to help you with your opiate addiction.
Rather than sending them across town, making them put them on a wait list for a treatment slot a week and a half, 3 weeks down the road, we can say, if you sit tight, we can have a doctor see you within 20 minutes.
We have folks who have chaotic lives. There's a lot going on, and with each step it takes to get into treatment, there's an opportunity missed. So we constantly see the more barriers there are to care, the less likely someone is to get the help that they need.
For those who don't get treatment, the goal is preventing overdose. And there have been some successes with an anti-overdose drug called Naloxone.
Through King County, we put out over 1,500 Narcan kits. We know from what we're tracking that at least 19 reported overdoses have, there's been a successful use of Narcan to bring somebody back to life. The Metro Police are carrying them, Seattle PD is carrying, many of our suburban cities, their police force is carrying them, EMTs countywide are now carrying them. So we've been really successful at getting Naloxone and Narcan out far and wide as possible.
The task force is also recommending supervised injection sites,
Pilot test what we're calling community health engagement locations, which are an extension of our needle exchange services to allow people who are currently using drugs in public spaces to use them indoors under the supervision of a healthcare provider to prevent deaths by overdose, to prevent transmission of infectious diseases, and most importantly, to give them a doorway by which they can access treatment for substance use disorder.
It's not only a public health response, but it's a law enforcement response. We've talked to our law enforcement partners and community partners all over the place that are picking up needles off the street, or trying to work with a family so that when they get off of a bus at a bus stop downtown or anywhere else across the community, they're not coming off of the bus and the first thing they encounter is somebody sitting at a bus stop with a needle in their arm.
We have all the tools we need to solve this problem. What we need now is the will and the resources to do so. This is a major epidemic that, again, is leading to a decrease in life expectancy in the United States. These deaths and substance use disorder are preventable, and they're also treatable.
If we don't start to get ahead of this curve and start to be able to provide treatment opportunities for those who need it, then we'll never be able to get ahead of this curve. And more families are going to experience the same tragedy that my family experienced, and the same tragedy that so many families across our community have experienced. That phone call from the hospital that said, "Hey, I'm sorry to inform you, but your brother passed away," it is an experience that I don't ever want anybody else to have.